Это не просто слова.
Pathogenic periods of myocardial infarction, ischemia, damage and necrosis. Because when the nutrition of the heart muscles stop due to obstruction of the cardiac vessels, firstly will be ischemia. Yes, because what is ischemia? It's insufficient blood supply and oxygen as a result. On ECG, it will be manifested with formation pathological T wave. It can be positive or it can be negative, but in all cases it has sharp top and it's symmetric. Normal T wave, I will remember you, asymmetric and rounded. If we'll see the T wave grows upward or downward, becomes sharp and symmetric, it indicates ischemic process. And if the patient clinically complains severe specific pain behind the sternum, we can see about myocardial infarction. If this process prolongates, you'll understand that heart muscles cannot longer work without nutrition, will be damage of muscles. On ECG, damage of heart muscles manifested with rising ST segment. Normally, ST segment must be isoelectric. It must be on the same level with the isoelectric line. We'll see ST segment moves upward. Ischemic process also present because its part is T wave. But when the ST segment rises, it moves also upper part of T wave. And T wave becomes invisible, but it's present. It's present. It's damage of myocardium. Now, if this process prolongs, later will be necrosis. Necrosis is manifested with formation deep Q wave. Q wave. And if the necrosis local, air wave can be kept. But if the necrosis deep, we'll say about transmural myocardial infarction. What does it indicate? It indicates that necrosis passes through the all layers of myocardium, endocardium, myocardium, and pericardium. ECG will be changed. T wave cannot be seen. T wave, air wave absent. Why? Because air wave indicates contraction of heart muscle. But if the whole heart muscle necrosis, how can it be contracted? It's impossible. Air wave cannot be. Instead, air wave will be pathological QS hiatus. This is both negative Q and S wave. They connected, and instead normal complex will see pathological QS hiatus and raised ST segment. Because during acute period of myocardial infarction, will be all pathological process, will be ischemia, damage and necrosis. All will be depend what time was registered ECG. If ECG registered 40 minutes after attacks of pain, we can reveal only ischemia. After 2-3 hours will be damage. After 6 hours will be necrosis. This process disappears. It indicates health of patient. During acute period, we'll give the patient strong blood regimen because every small excitation can provoke rupture of myocardium. But how can we know myocardium becomes health? If the damage disappears, it indicates that pathological process stopped in its progressive development. It's regressed. On ECG, ST segment moves to isoelectric line, but will be deep Q wave. And cannot be normal T wave, will be pathological T wave. It indicates only that pathological process stopped, but not completely health. When the myocardium health, will be deep Q wave as a result of formation scar ST will be isoelectric, but T wave becomes rounded, not ischemic. It only indicates disturbed tripolarization because impulse cannot usually pass it through the connective tissue. And when you answer on these questions, you gradually must examine firstly what wave? Firstly, T wave. Firstly, we'll exclude ischemia. Then we'll pay attention on
complex.
ST segment. We must compare it with isoelectric line. If ST segment on isoelectric line, you exclude damage. Then we'll pay attention on deep Q wave. And see, if Q wave accompanied with rising ST segment, it's acute myocardial infarction necrosis. If you reveal only Q wave but ST segment isoelectric, it indicates post-infarctive cardiosclerosis. This patient isn't needed in active therapy. See on ECG, which can be on exam. For example, this ECG, what do you see? Ischemia, damage or necrosis?
This one high.
Yes, but ST segment isoelectric, deep Q wave absent. We can say only about
Wait, ma'am.
ischemia. Only about ischemia. T wave ischemia. Plus ST damage. Plus Q necrosis. Only Q without ST and T. Post-infarctive cardiosclerosis. On this ECG, we reveal only ischemia and we'll see where it's localizes. It's not diffuse, yes? Because T rounded first, second, third. We'll reveal only heart apex, interventricular septum, and lateral part of myocardium. As a what? Pathological process localizes only this part of myocardium. Lateral part with involvement of apex. No. And when we'll start interpreting the ECG, present information that every lead has definite information about heart affection. Yes? First, and AVL anterior wall, third and AVF posterior wall, this again anterior wall, apex, interventricular septum, lateral.
И это все тебе, слышишь? Я люблю тебя, это не просто